All right, class, we're back, and today we're going to talk about one of our favorite subjects, which is medications, giving meds, and learning the proper way to do it and the correct way to do it. And let's make sure that you guys know how to actually do that in the correct manner and method. All right, so let's see here. We're going to move ahead and see if I can get this thing to go here. And there we go. So what is a drug? A drug is a foreign substance that we're going to be placing into the human body. Now, that's any drug, and a medication is more used, hopefully, for the betterment of someone, again, used for medical purposes. And as a paramedic, we're going to be giving those drugs to people to help them get better. Now, with all things that we do, there is goods that medication can do and bads that can do. So we need to make sure that we understand it. We've already started learning our medicines. We've already done a few medicines already, and we're going to continue to do medicines, the ones that we give in the pre-hospital environment, or even in the hospital environment. I think it's very important. I do not give a drug unless I know what it's going to do. More importantly, the good and the bad things that it's going to do. And if I'm not familiar with a drug, I become familiar with it before I administer it to any patient. So again, if it's an emergency med and we're going to have to use it quickly, have it ready, okay? And you need to know everything about that drug, what it's used for, what it's not used for. Even though you use it, it might cause something that you not necessarily want. And knowing the medicine, which way you give it. And I think the one that we use a lot is albuterol. Albuterol, we don't give it IV, okay? We nebulize it, we let them inhale it into their lungs. So we have to know what way we get it into the body. Now, hopefully you guys have learned this in EMT school, and if you haven't, you need to really commit this to memory, okay? The 6 R's of drug administrations. The right person means it's going to the right patient. Now, the good news is that for the most part, we are only dealing with one patient, so that's the right person. The right drug, let's make sure that we've got the right medicine. A little story I tell about this is we used to have in a service that I was at, we had the succinylcholine right next to the cardizem. And what happened was the paramedic thought he was giving cardizem, and all of a sudden he stopped breathing. Well, the bad news is he got 6 months with me because he broke that one right there. Despite the little cap that says paralytic drug on the top of it, despite all of that, he gave the wrong drug to the patient, okay? The right dose. Obviously, you want to give the right dose to the patient. You want to make sure that it's therapeutic. Again, you don't want to give too much or too little. The right time. Again, for emergency medicine, that's kind of us. The right time is now. But nitro, for example, we give it every 5 minutes. That would be an example there. The right route. Again, giving it the right way. And some medications allow us to give it multiple ways. And actually, nitro is another good one. We can give it sublingually, but we can also give it transdermally, which gives it a slower absorption over a long period of time. We can also give it intravenously, again, for a lot faster effect, and we can quickly shut it off. The right documentation. Boy, it's not done until the paperwork's done, and boy, is that so very true. So make sure that you document anytime you give a medicine, along with what happened to the patient. I think that is so very important. Again, and you need to know all your meds and your protocols, and your EMS director, that is the person that decides it. Hint, hint, you're probably going to see that later. And again, standard precautions when we give a medicine. Just like any other patient, we're going to make sure we got our gloves on. That's just good practice. Make sure that you wash your hands, get your PPE on, any type of soiled patient equipment. Remember, if we're administering this stuff into the body, we can introduce bad things to them, okay? And so make sure that, you've got everything nice and clean. And again, when you're giving something IV, you actually want it to be in a sterile, using a sterile technique. And we'll talk about the aseptic technique. Sharps, if you haven't, we've already talked about this in lab a little bit, but I'm going to go a little bit farther. Yeah, we don't recap, bend, break sharps, manipulate the needles, you throw it away. If you absolutely have to recap it, you use a one-handed method. and we will demonstrate that in lab. But whatever you do, please, again, throw the needles in the sharps box where they absolutely do not go, where they absolutely 100% into the ground, into the seat cushion. Gang, technically, if we want to get really jerky about it, you stick a needle into the seat cushion, it's got blood in it. Technically, that whole bench seat is supposed to be replaced per OSHA standards. Let's not do that, okay? And again, remember, when you're given these medicines, remember that most of these things are designed for a single patient use, by the way. Every now and then you've got multi-vial, but again, most of the time they're kind of built, or especially in an emergency setting, around single patient use. Wear your stuff. I think I've beaten that one to death. And again, you need to make sure that you've got everything that you need. Now, medical asepsis, okay? And we briefly discussed this, but long and the short is we really want to hold our needles up. And the idea is we're trying to keep it sterile. The problem is once we get our needles or anything below the 90-degree plane, technically it's considered not sterile anymore. Even though it might not have touched anything, the chances of that happening are very high. Okay, we need to keep our needles covered, our equipment covered. It should be in a sealed container. Remember, if it's in a sealed, most of the time it is a sterile thing. And again, disinfectants, by the way, toxic to living tissue. Okay, so we don't really want to use those. And antiseptics is not toxic to living tissue. So that's the difference between the two. And I believe there's going to be some questions about that as well. Again, all blood and body fluids, if it's wet, gooey, not yours. And again, it's considered potentially infectious. Okay. Remember, needles go in the sharps box. The days of recapping a needle shouldn't be happening, especially if it's gone into a patient. It really doesn't need to happen. You recap a needle only as a last resort. Guys, we have sharp shuttles for this. We have the tools and techniques. Recapping a needle is dangerous. You have the chance of poking yourself. Let's not do that, okay? Again, we make sure that we give our response to the medications when we document it, okay? I think that's why. By the way, we kind of want to put down why we gave it and how we gave it and where we gave it, by the way, especially if you got two IVs. I gave it in the left AC, right AC, whatever that might be. But you want to put exactly where you gave the medicine at. That is part of your documentation regimen. Now, our routes of administration. Again, we can give it through the skin, percutaneous. Pulmonary is through the lung. You usually breathe those in. Enteral, which is usually through the gastrointestinal tract. Parenteral means that you probably need a needle to give it. Okay. Enteral can technically, it's through the GI tract. There's some other ones, but there's some other things that can go into that as well. So again, in how the medicine is absorbed, by the way, is kind of important. So percutaneous means, again, through the skin. And transdermal is usually a slow, steady absorption. I use that. It's usually a lotion or an ointment or a cream, some sort of wet dressing. And yes, a suppository is technically considered percutaneous, okay? I think that's kind of breaches between that and a parenteral route, or enteral route, excuse me. So again, standard precautions, again, we make sure that we don't want to contaminate the medicine, and clean and dry skin is where we're going to apply these guys. Okay. Sorry. Again, now the places that we can administer: the tongue, the cheek, the eyes, the nose, the ears. Well, Scott, we don't hardly give any medicine. Well, tetracaine we give to the eyes, which is a numbing medicine to the eye. Tongue and cheek, we spray nitro up underneath those guys. Kind of rare for us to do a nose or an ear, but it actually the one nose one I will say is yes, there is such a thing as medical cocaine, and yes, it is used to stop nosebleeds. So yes, you might see that in an emergency room setting. Mucosal membranes, again, it absorbs a little bit faster than the skin does. A sublingual is a little bit faster. It's usually between the tongue, and they usually use a dissolvable tablet, a spray, or some sort of melt that goes up underneath the tongue to help it absorb a little faster. Key thing is, let's tell them to make sure to put the tongue to the roof of the mouth, and then we're going to slip up that tablet underneath there, and then hold their tongue down. Tell them not to swallow. You just want it to sit there and dissolve. Okay, that's the idea behind that. Again, the roof of the mouth thing, I've used the, hey, pretend like you're licking peanut butter off the roof of your mouth. That's usually a pretty good way if you need to explain how you want them to do that. Again, you just place it under there and you wait for it. The buccal region is considered the oral cavity between the cheek and gum, and there are tablets. Very rarely are we going to give that in the pre-hospital medicine setting. But again, we need to confirm everything just like we would get our 5 R's, and then let that happen. Ocular medicines, again, it usually goes into the drops in the eye, usually, and we're going to show you how to do that real quick. But these are the little abbreviations for both the right. These are Latin terms, by the way. But long and the short is just kind of be aware that if you've seen them, you know where they come from. And again, when we give these medicines, usually we pull the eyelid down and we administer the drops, however many drops it is that's prescribed, and right there we have them close and then blink the eye a couple times. By the way, the mucosal atomizer, we love that sucker because, again, that's usually for our Narcan administration now. Versed can also be given via mucosal atomizer device. So these MAD devices, it looks like a little cone and it sprays out a mist. It's a beautiful thing. So, again, nasal medicines, we love that sucker. So intranasal medicine kind of becomes a little bit bigger, okay? Remember your oral medications. These are the ones that go into the ear. Again, however many drops, usually we tilt the head to the side, manually open the ear canal, kind of spread it apart, and then and you need to let it sit there for about 10 minutes. And again, usually, again, giving it in the ear is pretty safe. Last one we're going to do is the pulmonary medicines. Now, you usually use a handheld nebulizer or a small volume nebulizer. Small volume nebulizer, guys, what I call a peace pipe. Again, it looks like they're smoking it, but they're really not. They're inhaling it. And the key thing is we got to get them to inhale it after we aerosolize whatever medicine that we're doing. So again, our big ones are, again, albuterol, Atrovent. Again, we usually put these up 5 to 8 liters per minute, and then have them put it in the mouth and inhale it, okay? Now, remember, you got to have an exit way as well because, especially in your nebulizers. And, by the way, we can give nebulized medicines via the CPAP, okay? Remember, and by the way, you can also use this adapter for your endotracheal tube. But, again, the key thing is you got to let it aerosolize in order to get in. By the way, these things are absolutely wonderful. Make sure you got them on your truck. If you don't have them on your truck, you really need to get them on your truck. Because, again, this allows you to administer a neb treatment while you're actually forcing the air into the lungs. And in certain situations, that is a absolutely wonderful thing. Meter dose inhalers are usually the small handhelds. Usually, like for albuterols, are like 200 doses in there. Again, shake the medicine. Make sure that you kind of move it around a little bit. And they're going to breathe out really good. You're going to put it in their mouth. They're going to squeeze and then take a really deep breath. And usually they'll self-administer these as well, okay? But again, breathe out, then spray, breathe in deep, because again, we want the medicine to get down into that tracheobronchial tree to absorb, okay? Now, we're going to hold off here. We're going to start on the next video there, and I'll see you then. See you on the next one.